I'm a little nervous. It's my first poster presentation, so bear with me, everybody. We're going to talk about outpatient fluid resuscitation in the post-operative bariatric patient. So in recent years, I'm sure we've all seen a huge uptake in bariatric surgery as a treatment for obesity. This complicated population has a complicated set of post-operative issues. One of those being dehydration. It has been identified as one of the most common complications after this surgery. So traditionally, because these surgeries are so complicated, we would send these patients to the emergency room department or even readmit them to be treated for dehydration. However, as this has become more popular, we've noticed that we can do this in the outpatient setting. And especially now in the COVID life that we live in, this is very, very important to us. So my goal was to create an outpatient infusion program within our infectious disease clinic that would help drive down healthcare costs and help increase patient satisfaction. So my question was, in the postoperative bariatric patient, does outpatient fluid resuscitation versus inpatient treatment or even an emergency room visit increase patient satisfaction and decrease healthcare costs? So for this, I wanted to focus on two different theoretical frameworks. First, I wanted to focus on Gene Watson's theory of caring, which was focusing on the human interaction, that human-to-human interaction that can be hard in an emergency department, especially now when they're always so busy, or even in an inpatient area where we're always doing something new. But I also wanted to focus on creating a caring and healing environment, which again is sometimes hard in those areas. I also focused on the Iowa model revised for evidence-based practice. So I wanted to really identify a specific problem, synthesize the evidence that we had, and really go about implementing those changes. So if you look to the right, you can see just a brief literature review. These are not all of my references. If you want to check out all the references I have, you can scan that QR code in the top right corner. There's also some addendums up there, but if you look at the general, you can see that dehydration is one of the top three problems, top three complications, related to bariatric surgery. And so it's definitely higher on the list of things we need to treat. And of those, dehydration patients are 22 times more likely to visit an emergency room department, and nearly 47% of those were deemed preventable. So it's quite a high number. And then when you look at infusion, we can see home infusion is preferred by patients. It provides them with a greater quality of life. It decreases their healthcare costs, and it doesn't skimp on any safety. So it's just as safe as doing it in an inpatient setting. So definitely we can see how we need this in the outpatient setting and how dehydration treatment outpatient, along with some outpatient education initiatives, can really change the course of these patients' lives. So I just kind of want to take you through my timeline. In November, December of 2020, we looked at getting our initial allocation of resources. We needed new chairs, new area for this infusion center while it was attached to our infectious disease clinic. We couldn't be seeing ID patients and doing an infusion center at the same time. So looking at new spaces, we really wanted to get senior leadership buy-in. Now we know that starting any new clinic is a huge major upfront cost. So it was all about talking about getting the benefit out of this and what our costs look like and the benefit to the patient as well, and how this helped us decrease healthcare costs by not overutilizing the ED. In January of 2021, we began our policy and protocol development. This was extremely important as most of the infusion center situations with our dehydration patients were going to be nurse driven. So we needed a policy and protocol to support their licensure that was approved by all of the providers involved. We also wanted to create that collaborative workflow between our infectious disease clinic and our bariatric surgery team. In February of 2021, we were able to start interviewing some new staff, which was really exciting. We were able to finalize that policy, protocol, and workflow. and additional resources. We were still looking to get pumps and tubing and all of those fun things that go along with infusion. In March of 2021, we hired a new nurse, and we were finally able to see our first bariatric patient and provide a debrief for that. It was very exciting for us. It went really well, and we were all really excited about it. As with any new situation, there's some areas where we needed to adjust the workflow and how things went, but it was overall a very positive experience for both us and for the patient. We hit a little bit of a crazy spot though between March and April. My hospital was bought out by a separate hospital system, and so we became Multicare in April of 2021. So all of those buy-in and the protocol and the policies actually had to be reapproved. So I kind of had to go back and start from square one and get all of the buy-in again and re-present my policies and protocols to the new senior leadership team. So we kind of had to start over. In addition to that, we got a new computer system. So as you can see, we had to talk about charting in our new computer system, and we were still training our new RN. But what came out of this was also the new hospital system brought with us a new idea of how we could utilize our medical assistants. So we started discussing increased roles for our medical assistants. We had a medical assistant who was IV trained, so could we utilize them? Is that prohibited in our state? So we really got into these types of discussions, which was all very exciting. In June and July of 2021, we were really focused on increasing patient visits and finalizing of those abilities and criteria. I wish I could tell you I had more results, but unfortunately at this time, I was also very pregnant. So in June, I had my baby and I have not returned to work yet. So I have not been able to see those results. What I'm hearing is very positive things though. Our bariatric team has been able to send multiple patients per week, and we're seeing great and positive results. In conclusion, the collaboration between the clinics provided us with a great environment for growth and creativity. The nurses felt listened to, and they were able to provide a great option for our patients. Outpatient infusion therapy now can be looked at in a different light, where we can talk about antibiotics and other types of drugs that we can use in the infusion center. Obviously, we had some significant barriers that were created that we were able to breach through the knowledge of change management. Continued transparency and emotional intelligence really help facilitate the change necessary, specifically with the change of ownership. And that is all I have. Again, if you want to check out my references, you can scan this QR code up at the top right corner. I also have some addendums where I created a patient satisfaction survey and some other things there if you would like to look at those. Does anybody have any questions?